haven't stopped staring at that thing for hours. You're obsessed with it.
Duh, Carly. It's a device given to me by medical superheroes. Of course I'm obsessed with it. You're just jealous you don't have one.
Whatever, little brother. I'm going for a soda. Jealous? Me? No way. But I do wonder if it comes in green.
So, I just want you to understand that because of GVHD, there's a chance the donor cells might attack Jett's cells. But
what? But what? Loudly finish your sentence, please. The donor cells are going to take over my body and destroy my awesomeness and good looks. The Medikidz will know what to do. Come on, come on. There's gotta be some sort of distress signal on this thing. Medikidz, where are...
Deep in outer space at the secret headquarters of the Medikidz.
You? Hump, Skindy, there you are. I did it. I activated the super secret distress signal.
No, the Medikron doesn't have one of those.
It does. However, monitor your pulse. And we saw that you were freaking out.
You guys have to help me. The doctor mentioned something called GVHD and how the donor cells are going to attack my normal cells and...
Whoa. Slow down. Listen, I know last time you were here we taught you all about stem cell transplants and gave you the Medikron full of info, but...
Before we explain graft-versus-host disease, or GVHD, we need to see how much you remember. And there's no better place for a refresher course than Mediland.
With a quick trip on the teleporter, our heroes find themselves in the bone marrow of Mediland, a planet that looks and works just like the human body.
Whoa! No matter how many times I come here, this place is just... whoa!
Remember, you're getting a stem cell transplant to replace unhealthy blood cells with healthy blood-forming cells called stem cells.
Oh, I remember this! Stem cells are awesome! They can become any type of cell your body needs, from red blood cells to platelets.
That's right. Now, there are different types of transplants. A transplant that uses healthy stem cells from someone else, a donor, is called an allogeneic transplant.
Remember, the immune system's job is to protect you from getting sick by fighting things that don't belong in the body, like germs.
Come on, I was just going to start a little fever, super tiny. You'd have really noticed it.
Not on our watch, germ.
Cells in your body, including stem cells, have a special marker that helps the immune system know that they belong.
Oh yeah, the HLA marker.
HLA check. Okay, it matches. Move along.
When you have an allogeneic transplant, it's important that the donor stem cells look very much like yours. This way, there's a better chance that they will accept your body as their new home.
Hey, we're home.
Sweet.
Hi.
Are you guys seeing what I'm seeing?
His marker is different than ours.
Where are we?
Attack!
If the donor cells don't recognize the markers in your body, then they get confused. And, as you can see, if they don't recognize your body, they might attack.
Which causes all sorts of problems, like GVHD.
I can't watch. Well, I can watch a little.
Get in, boys.
All I said was hi.
Things are getting a bit crazy in here, so let's head back to HQ.
So that did not look like something I'd want happening in my body.
GVHD is common and can be a serious problem that happens in about half of the kids who get an allogeneic stem cell transplant.
As you saw, in GVHD, the donor cells attack the cells in your body. There are two types of GVHD, acute and chronic. Each type affects different parts of your body and causes different kinds of problems.
Graft equals donor stem cells. Host equals you, the stem cell's new home.
Acute means it happens all of a sudden. Acute GVHD usually starts within 100 days after a transplant.
Chronic means it happens over a period of time and lasts longer. Chronic GVHD usually happens 100 days or more after a transplant. For now, we're going to tell you more about acute GVHD.
Symptoms of acute GVHD usually start to appear once the stem cells settle in your bone marrow and start to make new blood cells.
In acute GVHD, the new blood cells can attack the skin, digestive system, or liver, causing problems.
That doesn't sound good.
The first and most common symptom of acute GVHD is a skin rash of small, itchy red bumps. The rash usually starts on the palms of the hands or bottom of the feet, but may also be on the chest or back.
Oh, she looks like me after my sister made seafood burrito surprise for dinner.
Yeah, acute GVHD can affect the digestive system, causing diarrhea, upset stomach, and vomiting. People with acute GVHD may lose their appetite and not feel like eating.
Acute GVHD in the liver can cause yellowing of the skin and eyes and a sore belly.
Symptoms of acute GVHD can be different in each person. Oh, one good thing is that if your stem cell transplant is for a blood cancer, the new blood cells can even help in destroying any cancer cells that may be left in your bone marrow.
I like that. So how can the doctor be sure I have acute GVHD and not just a stomach ache or something?
The doctor can usually tell by looking at all of your symptoms together and seeing when they started happening.
But to be absolutely sure it's acute GVHD, the doctor may also need to run tests on the part of the body where you're having problems.
The earlier GVHD is treated, the better. So it's very important to tell your parents and doctors if you don't feel well or notice any changes in your body.
GVHD sounds bad. What do we do?
Well, when someone has GVHD, it's important to stop the new blood cells from attacking the body. Medicines called steroids may help. Depending on your symptoms, the doctor may give you steroids as pills to swallow or creams to rub on your skin.
These steroid medicines are meant to calm down your new blood cells so they have more time to get used to your body.
Well, I'm glad there's medicine that can help.
Totally. But you need to know that while you're on these medicines, you may be more likely to get sick, such as an infection. So it's important to tell your parents and doctor if you have a fever.
Also, steroids don't always work for everybody, so your doctor may try something else if you don't get better.
Remember to take any medicines your doctor gives you, even if you are feeling okay.
It may take some time for the new blood cells to accept your body as their new home.
Yeah, cool.
I'm getting the feeling that things aren't necessarily cool.
Yeah, what's up, Jett?
I'm just a little scared, you know?
Dude, it's totally normal to feel scared, sad, worried, you name it.
And listen, you may not get acute GVHD, but if you do, you are not alone. Your doctors and nurses and your family are all there to help you feel better.
Well, I better be getting back. Thanks again for helping me, Medikidz.
Anytime, buddy.
Feel better. Don't worry, we'll be keeping an eye on you.
Hey, Jett, No! Are you reappearing right now? How did you go on an entire adventure to another planet in the time it took me to get a soda?
Better question. Why was I able to go on an entire adventure to another planet in the time it took you to get a soda?
I couldn't decide on a flavor.
Well, pop that soda, sis, and take a seat, because do I have a story for you.